Welcome back. This is the Osher Lifelong Learning Institute course on maintaining optimum brain health and fitness. I'm Len Matheson. We're presenting 5 useful tools to maintain optimum brain health and fitness in this course. This is the third class in the 5-class series. Today we're presenting Brain-Restorative Sleep to postpone dementia. This young man has certainly had a good night's sleep, and I hope his parents have had some brain-restorative sleep to be able to keep up with him. Now, brain-restorative sleep is a crucial part of our homeostatic balance. Back when we were starting our families and our careers and juggling all of those without falling off of our unicycles, we had reserve capacity that allowed us to, for the most part, maintain homeostatic balance. We weren't sick very often, and we typically rejuvenated over the weekend and were ready to go on Monday. Now that we're older and a little less active, we'd like to just lay back and let homeostatic balance continue to take care of us. The problem is we've got less reserve capacity. Over the last 2 class sessions, we've been talking about how to develop our reserve capacities, both cognitive and physical, by taking on just right challenges. Last week, we talked about how to protect and nurture a healthy hippocampus. Today, we're going to talk about how to develop brain restorative sleep. To postpone dementia. Now, there are a lot of people who think I am much too optimistic about this idea of postponing dementia. I'd like to give you some of my background. I first started my career on February 3, 1970. I've worked most of my career in academic medicine, teaching and doing research in medical rehabilitation in some of the best medical schools in the country. One of my most important lessons is that disease does not determine dysfunction if we have adequate reserve capacity. One of my early teachers was an Army surgeon from the Korean War who shared this with me. Autopsies on 300 American soldiers in their 20s and 30s found substantial heart disease. But the hearts of these young men did not let them down. They were killed by enemy fire. So they had a disease process going on that hadn't produced dysfunction. And that's actually what I found in more than 10,000 of my patients over the past 50 years. For most of these folks, if they were able to separate disease from dysfunction, they got back to full and successful lives. Not everybody can do that. Many people have convinced themselves that once they have a horrible disease, dysfunction quickly follows. And that's a major trap for our concern about Alzheimer dementia. Most people who aren't healthcare professionals don't think twice about the difference between Alzheimer's disease and Alzheimer dementia. On television news, they hear that there's no cure for Alzheimer's disease. And when they reach 70 years old, they start interpreting every little cognitive slip-up as the onset of their Alzheimer dementia. And that's just not the case. Alzheimer disease and Alzheimer dementia are not the same thing. In fact, the relationship over the course of our lives is quite poor. What we now understand is that although there are not yet any cures for Alzheimer disease, to the degree that we do our best to develop reserve capacity and control the risk factors, we may never notice the dysfunction. People who have more reserve capacity can actually have quite a bit of the disease, but maintain rich and active and fulfilling lives without noticing dysfunction. Let me see if I can illustrate this by returning to take a look at Dr. Betty Beaker, who we met last week in our 2nd class session. This is a graph of Betty from age 40 in terms of her reserve capacity compared with the Alzheimer disease process. You can see that she's got a little bit of disease at age 40, and that it gradually increases and begins to accelerate after age 65. And you can also see that her reserve capacity outpaces the disease process so that she doesn't become disabled until age 100. And what would happen if Betty developed good brain restorative sleep habits at age 65? That's our topic for today. She's got the same reserve capacity, but look what happens at the rate of the progression of her disease. And so this is how I approach Alzheimer dementia. Of course, that's not a picture of me. I don't wear glasses, but that's how I feel about Alzheimer dementia. I'm going to do whatever I can to postpone its onset. I'm going to pay attention to high-quality, peer-reviewed scientific research to guide my approach to take care of my brain. And brain restorative sleep is a key part of that. Take a look at this brief segment of video.
Let me tell you about what we found. So the brain has this large pool of clean, clear fluid called cerebrospinal fluid. We call it the CSF. The CSF fills the space that surrounds the brain, and waste from inside the brain make their way out to the CSF, which gets dumped along with the waste into the blood. So in that way, it sounds a lot like the lymphatic system, doesn't it? But what's interesting is that the fluid and the waste from inside the brain, they don't just percolate their way randomly out to these pools of CSF. Instead, there is a specialized network of plumbing that organizes and facilitates this process. You can see that in these videos. Here, we're again imaging into the brain of living mice. The frame on your left shows what's happening at the brain's surface, and the frame on your right shows what's happening down below the surface of the brain within the tissue itself. We labeled the blood vessels in red, and the CSF that's surrounding the brain will be in green. Now, what was surprising to us was that the fluid on the outside of the brain, it didn't stay on the outside. Instead, the CSF was pumped back into and through the brain along the outsides of the blood vessels. And as it flushed down into the brain along the outsides of these vessels, it was actually helping to clear away, to clean the waste from the spaces between the brain cells. But our most surprising finding was that all of this, everything I just told you about, with all this fluid rushing through the brain, it's only happening in the sleeping brain. Here, the video on the left shows how much of the CSF is moving through the brain of a living mouse while it's awake. It's almost nothing. Yet in the same animal, if we wait just a little while until it's gone to sleep, what we see is that the CSF is rushing through the brain. And we discovered that at the same time, when the brain goes to sleep, the brain cells themselves seem to shrink, opening up spaces in between them, allowing fluid to rush through and allowing waste to be cleared out. Now, I've just talked a lot about waste clearance, but I haven't been very specific about the kinds of waste that the brain needs to be clearing during sleep in order to stay healthy. The waste product that these recent studies focus most on is amyloid beta, which is a protein that's made in the brain all the time. My brain's making amyloid beta right now, and so is yours. But in patients with Alzheimer's disease, amyloid beta builds up and aggregates in the spaces between the brain cells instead of being cleared away like it's supposed to be. And it's this buildup of amyloid beta that's thought to be one of the key steps in the development of that terrible disease. So we measured how fast amyloid beta is cleared from the brain when it's awake versus when it's asleep, and we found that indeed, the clearance of amyloid beta is much more rapid from the sleeping brain. A series of recent clinical studies suggests that among patients who haven't yet developed Alzheimer's disease, worsening sleep quality and sleep duration are associated with a greater amount of amyloid beta building up in the brain. And while it's important to point out that these studies don't prove that lack of sleep or poor sleep cause Alzheimer's disease, they do suggest that the failure of the brain to keep its house clean by clearing away waste like amyloid beta may contribute to the development of conditions like Alzheimer's.
As I said in class, Jeff and his collaborators are going to win the Nobel Prize for Physiology or Medicine in the not-too-distant future because this is a huge finding that's opened the door to a wide range of possibilities. In the brain, CSF clears clutter that clumps. The idea is that if CSF clearance can stay ahead of the clumping of amyloid beta into plaques, our neurons will stay healthy. And what's wonderful about this is that we've got some control over how to stimulate this process because more than 90% of the clearance of the sticky amyloid beta protein fragments occurs during our sleep. Now take a look at this short video for another perspective.
For example, ApoE4 is a gene variant that increases amyloid. But you can inherit a copy of ApoE4 from mom and dad and still never get Alzheimer's, which means that for most of us, our DNA alone does not determine whether we get Alzheimer's. So what does? We can't do anything about getting older or the genes we've inherited. So far, we haven't changed our brain's destiny. What about sleep? In slow-wave deep sleep, our glial cells rinse cerebrospinal fluid throughout our brains, clearing away metabolic waste that accumulated in our synapses while we were awake. Deep sleep is like a power cleanse for the brain. But what happens if you shortchange yourself on sleep? Many scientists believe that poor sleep hygiene might actually be a predictor of Alzheimer's. A single night of sleep deprivation leads to an increase in amyloid beta. And amyloid accumulation has been shown to disrupt sleep, which in turn causes more amyloid to accumulate. And so now we have this positive feedback loop that's going to accelerate the tipping of that scale.
This next generation of scientists is giving us hope. I hope at this point that you are starting to feel some sense of hope. Hope to deflate depression and anxiety is a big part of our success, and I want to do whatever I can to help you with problems that might be getting in your way. That's one of the reasons I'm so excited about brain restorative sleep. It not only helps the brain maintain its health, it helps us with both depression and anxiety. Whether I have a patient with a concussion, or a stroke, or a major depressive disorder, or an anxiety disorder, they'll benefit from having healthy sleep. So let's get introduced to healthy sleep. This is a graph I'd like you to stop and look at more closely when you've got a chance. It's got a lot built into it. This describes 6 cycles of sleep over the 9 hours from when we put our heads on the pillow at 10 p.m. until we awaken at 7 a.m. 6 sleep cycles over 9 hours is the goal that I have for my clients with concussions and strokes. For the rest of us, 5 sleep cycles seems to be adequate. That would require between 7 and 8 hours of high-quality sleep because the average sleep cycle is about 90 minutes. One of the indicators that you're getting good brain restorative sleep is that you don't need to use an alarm clock to awaken. Because you have control over when you're going to sleep, you can anticipate when you're going to be in stage 1 sleep and ready to awaken. You do this by calculating 1.5 hours on into the future. If you put your head on the pillow at 11 p.m., 6 hours later is 5 a.m., which would be at the end of your 4th sleep cycle. The discipline that comes from awakening at the end of your cycle allows you to get away from using your alarm clock. We have 4 levels of sleep depending on the dominant brainwave cycles. Level 1 is when we are easily aroused, and level 2 is starting to fall into a deeper sleep. Level 3 is where we spend a lot of time each night. Level 4 is where we get into with the first few sleep cycles. Notice that the duration of the rapid eye movement sleep cycles, they're called REM cycles, increases over the course of the night. This is when we do most of our dreaming. It's at the end of each of those cycles that we are normally able to awaken to adjust our bedclothes, or use the bathroom, or change our position in bed, and then quickly fall back asleep. I like to consider the first couple of sleep cycles as exhausted sleep. And if we're having good restful sleep, I think of the remaining cycles as restorative sleep. Of course, all of it is restorative, but I like to differentiate between the first 2 cycles of exhausted sleep to help people appreciate that falling asleep quickly doesn't necessarily mean that you're getting brain restorative sleep. It's good that you can fall asleep quickly, but if you don't have high quality sleep over the course of the night, that's not brain restorative. So let's take a look at the Brain Restorative Sleep Guidelines, which is one of the handouts that I've provided to you this morning. I'd like you to identify one guideline that you can apply to yourself, that you can work on and improve over the next week. I want you to work on improving one new guideline each week so that you can gradually develop what I call good habit momentum with regard to your sleep habits. And I want to point out that you've got biology on your side. Your brain really does need to sleep. It wants to sleep. You can develop some new sleep habits that you can change gradually that will move you in the right direction. And what we're doing is developing tools to help maintain our homeostatic balance, even though it can get somewhat precarious as we get older. The first of these tools, and the most important one, is to become synchronized with the Earth and the Sun. Everything on the planet is in what we call circadian rhythm, in sync with the rising and setting sun. This goes in spades for human beings. Industrial development and electrification over the past few centuries have created problems that are taking us out of synchrony with the sun. These women are happy, and these men are happy because they are synchronizing themselves with the sun. And they look like they're having fun, too. Circadian rhythm sets all of our biological clocks with every sunrise and tries to keep us in sync through every sunset. What if we get out of synchrony? Well, that's a very important issue, especially in January and February in the Northern Hemisphere. In Northern California, where we live, many people have some degree of seasonal affective disorder. Luckily, this is easily treated with a combination of vitamin D and broad-spectrum light. So the first thing that I want you to do is to take a look at how you start your day. I want you to begin your day with as much exposure to the sun as possible. That's going to set your master clock in what's called the suprachiasmatic nucleus and all of the other clocks throughout your brain and body. Everything is going to get synchronized by the sun. Now let's take a look at the sleep diary I want you to start filling out tonight. We don't have time to do anything other than touch on a few of the guidelines in the handouts, but I want to address a few of those that are most important. The first issue to consider is caffeine. Caffeine is a neurochemical that blocks another neurochemical called adenosine. Adenosine is what forces our brain to sleep. The caffeine molecule slips into the adenosine receptors in the brain and blocks the adenosine from having its designed effect. Caffeine has a half-life of between 5 hours and 6 hours in our bodies. That means that 5.5 hours after your last cup of coffee, the effect of caffeine is about half of what it was when you drank that cup. The question for you is, when will the caffeine effect drop below the adenosine buildup and put your brain to sleep? And by the way, research shows that about 25% of all fatal transportation accidents are due to adenosine buildup, because the driver or operator of the vehicle is trying to stay ahead of his sleep without realizing that the adenosine buildup was continuing. I've got some pretty horrible stories about accidents that help me be very intentional about how I manage my adenosine. Caffeine and theobromine and theophylline are also found in tea. These neurochemicals in strong tea are all effective and also stimulants that interfere with sleep. Chocolate too. I love chocolate, but I won't have any after 4 p.m. if I'm planning to hit the pillow at 10 p.m. The same with caffeine and theophylline. I dose myself with these chemicals to protect my sleep. And how about alcohol? Take a look at how your alcohol use is affecting the quality of your sleep. Alcohol is a very effective central nervous system depressant. Many of us, including me, will help ourselves get to sleep by using a nightcap. I used to use brandy or scotch. It's very effective to help us get to sleep, but a few hours later, when we're in the process of trying to develop restorative sleep, it makes us restless. Try not to use alcohol to put yourself to sleep. And then we've got the sleep medications. Older people need to be very careful about this. This is one of the most important reasons to talk to your doctor about a sleep disorder. Over-the-counter sleep aids are very effective and inexpensive. The problem is that they diminish our availability of a neurochemical called acetylcholine. Acetylcholine is crucial for cognitive function and motor function. It does a lot of other things, but I want you to realize that you don't need anything else to limit your cognitive function, and you certainly don't want to do something that intentionally limits your motor function. We think that these medications are one of the reasons that many people our age are injured in falls. They are great at putting us to sleep, but they also put us at increased risk for falls. They also worsen cognitive function, cutting into our cognitive reserve capacity. If you need a sleep med, talk to your physician and start working on brain restorative sleep. One of the things that you'll notice on the sleep diary is a section on PMR and PPR. That stands for Personal Mantra Relaxation and Personal Prayer Relaxation. Those are strategies that I developed many years ago. They integrate a lot of what people call these days mindful meditation, but they take it a step further. The basic idea is that you identify a word or phrase that recalls a time in your life when you're safe and comfortable and relaxed, and you use that word or phrase in your mind's ear with every slow exhalation during the process of progressive muscle relaxation. That trains your brain and nervous system to have that word or phrase calm you down at any time of the day or night. It's one of the most important tools for me to put myself back to sleep when I awaken in the middle of the night. Take a look at this video and consider using it tonight to help you get to sleep.
Personal Mantra Relaxation. Find a safe and comfortable physical space where you want to relax. My voice will lead you to relax and control your tensions. Allow my voice to lead you to relax and refresh your body and your mind. My voice will lead you through methods to train your brain to relax your body by using a word or a short phrase that we will call your personal mantra. Your personal mantra is a word or a short phrase that we will link to profound relaxation, so that whenever your personal mantra is used, it will cause you to relax. These instructions may cause you to sleep. Set your listening device so that if you fall asleep during the instructions, you can continue to have relaxing and refreshing sleep.
And the final thing we have time for now is to recognize that naturally occurring melatonin is very important to synchronize many of the clocks in your brain. You need to protect the melatonin buildup and not inadvertently dissipate it. Bright light, especially blue light, destroys melatonin. Melatonin is produced in the pineal gland of the brain and builds up right next door at the suprachiasmatic nucleus. Let's call that the SCN. The SCN sits at the junction of the optical nerves. So the light coming through your eyeballs and optic nerves back to your brain goes right to the SCN and intentionally destroys the melatonin so that you can get up and get ready for your day. But you don't want it to do this at 11:30 p.m. The melatonin has been building up since late in the afternoon, and it's a terrific resource for you to protect. So that's one of the reasons that we ask you to rate yourself from 1 to 10 on the job that you've done protecting your melatonin buildup. If you've not done a good job with that, it's one of the things that you can improve. And one of the simple ways to improve that is to use glasses like this if you're working at your computer at night, or in a bright kitchen, or another bright room, or sitting close to your TV. And so to wrap up for today, here are the 3 references that you can use as resources. Jeff Iliff and his TED-Med talk back in 2014. It's a great talk that you'll learn a lot from. Second, Lisa Genova, the author of Still Alice, gave a great TED Talk in 2017 that you'll enjoy watching. Both Jeff and Lisa are wonderful examples of the next generation of neuroscientists who are leading the way in addressing serious neurological problems with age. I pay attention to both of them, and you should too. And finally, you can go to the Epic Rehab YouTube channel for videos on both personal mantra relaxation and personal prayer relaxation. The mantra is for people who don't have a faith background or spiritual orientation. The prayer version is for people with a faith background. They parallel each other and are both helpful. So until next week, where we will talk about exercise and nutrition to maintain brain-body homeostasis, I wish you pleasant dreams and brain restorative sleep. Sleep well.